Hey everyone, and welcome to Autism Awakening, the podcast that helps you help your child with autism. My name's Dr. Jared Skowron, and I've been an international biomedical autism doc for 21 years and have this podcast to help you, whether you're the parents, the grandparents, the health professional, the therapist, anyone who has a child with autism in their life and wants to learn about more ways to help them. We focus on the medical aspects of autism, which is a wonderful way to help your child in addition to the therapies that they're probably currently already doing. So 2025, we've been introducing a mini series of podcasts that kind of walk you through all the different medical aspects of autism. And these are the medical issues that I work with my patients in my telemedicine practice. So we talked through January about different causes of autism. We talked about genetics. We talked about regression. Then in February, we started getting into some gut work, talking about constipation and toe walking and behaviors. We also talked about gut infections like candida and parasites. So now we're starting to roll into different ways that we can help kids with their language and their speech. Okay. Now, as a side note, we record this podcast live on our Facebook page every Thursday at 12:15 p.m. Eastern Standard Time. I take my lunch and record a podcast, and then we post it out into podcast world. So if you're ever interested in taking part of a live recording, just get onto our Spectrum Awakening Facebook page on a Thursday. You can tune in, you can listen, you can type your questions in the comment section and be part of it all. So let's jump into the conversation of how can we get more language with our kids. Now, one big thing we're going to be talking about today, and we're going to get into more details next week, is something called MTHFR and folinic acid. Now, folinic acid is a special vitamin that has a lot of research that it improves children's language in kids with autism. So we're going to be talking about a lot of that folinic acid research next week. We'll talk a little bit about it today, but wanted to make sure you guys know we are launching a high dose folinic acid powder. Now, I was talking to my producer just yesterday, and he's working on trying to figure out when that's going to be ready for us to get out to you. So if you want to know when our high dose folinic acid powder is ready and available, type the word FIRST into the comment section here on Facebook where you're at. Type in the word FIRST, or you can DM us on Facebook or on Instagram, message us, type the word FIRST. That'll automatically put you on a list. You'll be emailed as soon as we have this ready to go. All right. So let's get into the talk about speech. Now, where does speech come from? That's really the first question. And how does speech develop? So let's talk about speech in neurotypical kids, right? Or perhaps the speech development in your child before a regression. So speech starts with repeating. Speech starts with echoing, okay? We say mama, they say mama. We say dada, they say dada. We unfortunately say no, and then they start saying no, and then they never stop saying no. So language is learned through repetition, okay? I mean, even if we're taking a language class, in high school, I took Spanish in high school, like hola, okay, that's how we learn. So it starts from there, and then you start growing from echolalia, or repeating things, to scripting. And scripting is the use of groups of words in order to convey an emotion. Okay, so hey, how you doing is a nice script for meeting someone and introducing a conversation. Okay, or you say, hey, how have things been? I'm good, fine, thanks. Okay, we've got these scripts that just are kind of part of things. All right, and that's what our kids will do. In fact, one of my favorite stories, I had a child years ago. This is when I first started practicing. And his parents always hosted a lot of dinner parties. So whenever the dinner party was over, the child's parents would stand at the front door and say goodbye to everybody as they left. And they'd say, thanks for coming, thanks for coming, thanks for coming. So now the child, whenever he's ready to go, he'll say, thanks for coming, thanks for coming, thanks for coming. Because he's learned that phrase means an emotion, means an action. Okay. Then we eventually are able to take those scripts of emotions and then translate that into conversational language, back and forth kind of thing. All right. And I know a lot of our kids either may be nonverbal or just have some words or have decent language, but it always needs to be instigated. It always needs to be acted upon, okay? So they're not going to offer up a conversation, but if you ask, you get something back, okay? So those are the kind of layers of speech. Now, speech comes from the brain. Okay, speech comes from, actually, there's a side part of the brain here, both sides, that control hearing and language. And so the hearing part of the brain and the language part of the brain right next to each other, okay, right there by the ear, probably not coincidentally. So the first thing that we do is we hear things, and then our brain is able to interpret and give meaning to those. Then that information gets to the language center, and that language center then forms the words, and then it's got to get from that to our motor system so it can get out our mouth. All right. And that's where the trouble lies. So many of our kids have great receptive language. They're able to receive words. They're able to receive sounds and understand meaning. So the receptive part, normally really good. The problem is that expressive part. We got to get that expressive language out of the child. Okay. And that's usually where the biggest hurdle is. So what I've noticed over 21 years of practice is that when we make the brain work better, the language starts to come out. Now, what do I mean make the brain work better? Well, the brain is electricity. Okay, the brain runs on electricity. These nerves conduct electrons, and that's how things happen. Those electrons can be sent to different parts of the brain, and they can be sent very often or very rarely. Okay, so you can never change the speed of the brain. You can't change the speed that electricity is flowing, but we can make those signals happen more often, be more stimulating, or we can make them happen less often and be less stimulating. And this is where the balance of helping the brain work better is kind of generated from. Now, this is done pharmaceutically. Okay, you can go on an antidepressant, which slows down the number of signals that are being sent. So hopefully it'll reduce racing thoughts and the anxiety, depression that comes from those. Or you can be on an ADHD stimulant, which starts to activate the part of the brain that will send signals more often. And so maybe we get more focus or more attention because the signal is going through the brain, all right, and more often. I'll just keep saying the same words. So if we can change how often signals are sent, then we're going to change how one is thinking and one is feeling. All right. Just like we gave those examples pharmaceutically. So let me first go over the different brain chemicals that we're going to focus on. No pun intended. And then we'll get to some research. All right. So let me flip my camera around. I just typed this out today. This is a flowchart of what I like to do to help my kids with language. Okay. So there's different excitatory neurotransmitters we're going to talk about: glutamate, histamine, adrenaline, and dopamine. And then there's inhibitory neurotransmitters, serotonin and GABA. So the excitatory ones make the brain fire more often, and the inhibitory ones make the brain fire less often, right? And so the first thing we're going to do is reduce those excitatory chemicals. We're going to reduce glutamate. We're going to reduce adrenaline, okay? The next thing we're going to do is increase serotonin. And then the third thing we're going to do is add folinic acid, which I'll talk about in a little bit for language. And then the last and final step is increasing dopamine. So I kind of went over all that pretty quickly, but let me describe the method behind the madness, okay? Our kids, we all have these balance of excitatory or inhibitory, accelerator or brake chemicals in the brain that affect the speed of our brain, as I said. And think of it like, I use the metaphor of a car, all right? I got an accelerator and I got a brake, and hopefully I'm doing 75 on the highway. So, and we need a balance of that. We need both. We need the accelerators. We need the brakes. Without the accelerators, I won't have focus, okay? Without the brakes, I won't be able to sleep. So where is this balance in our child, and how can we make it better? So with our kids with autism, a lot of them, their brains are going too fast. Okay, they have too much of this substance glutamate, too much of the substance adrenaline, too much of the substance histamine, and that is going to make the brain go faster. Okay, that's going to delay learning. That's going to cause hyperactivity. That's going to cause sleep problems. Makes sense. So the first thing we're going to do is reduce those so that the brain isn't going so fast. All right, that's step one. We'll get into how to do this in a little bit. Step two, we want to push on that brake a little more. again, most of our kids, the brains are just going too fast. So we push on that brake by increasing the serotonin. So now we have less of that accelerator. Now we're pushing on the brake, okay? And now the brain function is starting to work at a speed that it should. Now we're going to start to add a few things that will change brain chemistry levels. The next step is folinic acid, okay? Like I said, we'll get into folinic acid ad nauseum next week in next week's podcast. But folinic acid is a vitamin that helps the production of many brain chemicals across the board. So now we're raising levels of a lot of different brain chemicals with the folinic acid, which is great. And the final thing we do is start to increase dopamine levels. Now, dopamine is a stimulant. It's an excitatory chemical. So, we really want to go slow when we do that. But if your child's having focus or concentration problems, this is where dopamine helps. So it's this 4-step process that I use with my patients to balance these chemicals in the brain, right? And you may have already tried some of these things with your child, may have worked or may have backfired. And I find a lot of kids have side effects to certain things like folinic acid because we haven't balanced brain chemicals. If your adrenaline and glutamate are busting out through the roof and you start giving methylfolate or methyl B12 or B vitamins or folinic acid and your child gets hyper, well, that's because there's too much already going on in that brain. And we've got to change and fix other things first before we do that. So there is a method that'll help our kids handle these things easier. Okay, and when I say easier, I just mean with fewer side effects, like hyperactivity. All right, so that's the 4-step process. Push on the brakes, okay, or pull off the accelerator, okay? Push on the brakes, and then add the folinic acid and start playing with some dopamine, and we'll start to see language come out. It's really cool, okay? Now, different people are going to respond to different things. We have certain people respond a lot of language when we add serotonin. A lot of people get a lot of language folinic acid. I'll have other kids get language with our dopamine treatments, okay? So any of these things can work. I have kind of seen patterns where boys will do better with serotonin and girls will do better with dopamine, but you never know until you're starting to trial and error and see how your child responds, all right? So let's do this. Let's walk through the research that I have and talk about the supplements that we've created to do this, and then we'll get to our live questions. All right, so step 1, pull off the accelerator, okay? We're going to reduce glutamate, we're gonna reduce adrenaline. How do we do this, okay? Well, let me show research first, and then we'll get into how to do this. All right. All right, here we go, guys. The role of glutamate in autism and the use of glutamate receptor antagonists in treatment. So glutamate is the major excitatory neurotransmitter in the brain, and there's glutamatergic dysfunction in autism. All right, so let's do the next one. The next one also has to do with this. Autism severity is associated with a gene issue called MAOA. Autism severity is associated with child maternal MAO genotypes, and autism severity is associated with poor MAOA genotypes. The worse the MAOA gene status is, causes more severe sensory behaviors, more arousal regulation problems, more aggression, and worse social communication skills. Okay, so just a couple research studies, but again, what are we talking about? We're talking about these excitatory neurotransmitters. We're talking about the glutamate. This didn't mention the adrenaline, but throw it on in there, okay? Our body needs to get rid of these. So how do we normally get rid of them? The body normally gets rid of them, okay? They don't just, they're created by food, by the foods we eat, and then our body gets rid of them, and all day long, we make it, we get rid of it. We make it, we get rid of it. This stuff doesn't just stay there forever, all right? So we need to get rid and remove this. So we use certain proteins to reduce glutamate levels, okay? So we have certain proteins like glycine, another one called cysteine, another one called theanine. The glycine and the cysteine will start to remove the glutamate from the bloodstream, convert it into glutathione, which is a healing substance, which is awesome. The theanine will block how that glutamate works in the brain. Next, we start using minerals like magnesium or lithium orotate, and these will start to activate this MAOA gene that we saw in the research. And this MAOA gene that we saw, if you have problems, there's more sensory issues, more aggression, more social communication issues in the research. It's because that's the gene that's responsible for getting rid of a lot of these excitatory neurotransmitters like adrenaline. So if we can activate that with minerals and we can start using proteins to reduce glutamate levels, you can start to see a calmer child. So that's step one. That's our supplement called anger management. So anger management, we designed to reduce glutamate, to reduce adrenaline, increase glutathione, and activate this MAOA gene that's associated with autism behaviors. Okay, that's step one. Now let me say this. With that anger management step one supplement, I don't normally see more language, but I see better behaviors, and then I see a better reception from the other supplements that are going to help with the language, okay? Because a lot of kids get hyperactivity side effects on those. All right. Next, let's get into the serotonin. Okay, remember, step two, increase serotonin, hit those brakes. So what do we have? We have serotonin and hearing loss. Serotonin plays a role in depression and anxiety, as we know, but it may also influence several aspects of auditory cognition, including auditory attention and understanding speech. Next, involvements of serotonin genes in accurate speech encoding. Serotonin has been shown as essential for modulating the brain response to sound. Okay? So serotonin, which many people don't know, is a brain chemistry. We know, hey, if I have low serotonin, I have anxiety, depression, right? That's typical. Okay, if I have low serotonin, I probably have bad sleep. But serotonin is essential for the entire speech process. It's responsible or very involved in the understanding and the comprehension, and then the translation of that to the speech centers so that we can get those thoughts out. All right. And trust me, I have been using serotonin natural supplements for 2 decades, right? And the ability for it to create language in some of our kids is amazing. So the more serotonin we can get in that brain, the more language is going to come out. Not in everybody, but I'll tell you, there's definitely big subsets of kids where this works. So I don't know if Natalia's on. Natalia's one of our great moms that shares a lot of her son Lorenzo's improvement. And she's been using serotonin for a long time, and his language definitely responds to it, which is great. Okay. Step 3, we use folinic acid. Now, let me give a brief introduction to folinic acid. It is a vitamin. It's a special form of the vitamin folate or folic acid, which you have in your prenatal or in a multivitamin, all right? There are many forms of folic acid. One of them is folinic acid. Another one's methylfolate. And, these are very important for brain chemistry. Very important for brain chemistry. I personally find the methylfolate form very stimulating, very overstimulating, cause a lot of hyperactivity, aggression, sleep problems in our kids. So, excuse me, that I don't use as much anymore as I now use folinic acid. And there's many, many research studies on folinic acid when it comes to speech with our kids. Now, because we're going to have just the folinic acid Facebook Live podcast next week, I'm only going to show one research study here, and then we'll move on. All right. So this is a great research study. It's very straightforward and obvious. Folinic acid improves verbal communication in children with autism. This was a randomized, double-blind, placebo-controlled study. Okay? You can't get any better than a double-blind, placebo-controlled study. Here's a group of kids with autism. We give them folinic acid. Here's a group of kids with autism. We give them a sugar pill. And the kids who took the folinic acid improved their language. Period. Okay? Now, again, nothing works for everybody. However, the amount of research on folinic acid is amazing, and clinically, I see great improvements. The question is dose. And, dosing in folinic acid can be anywhere from 0.5 milligram to 25 to 50 milligrams. And that's a wide dose. So we're going to be, again, next week we'll go over into detail about what dose is going to be best for your child. How can you determine that? But if you haven't tried folinic acid yet for your child, it is one of the number one things to try for language in your kids, okay? Be cautious. You can see this hyperactivity come about, all right? So if you see that, you've got a couple options. Option number one, reduce the dose of folinic acid. Option number two, increase that anger management supplement dose, because that anger management supplement was designed, and I formulated it, to reduce those overstimulating excitatory brain chemicals, okay? Quick question from Jasmine. Jasmine, I do recommend taking folinic acid away from dairy products. I'm concerned about absorption problems. So to be safe, I would do that. All right. Last but not least is dopamine. Okay. Oh, let me go back. Step one is our anger management supplement. Step two is our serotonin supplement. It's called super serotonin. And then our folinic acid supplement is called super folinic acid. The fourth step, again, we're trying to improve focus and concentration in our kids, so we want to increase dopamine levels. Now, again, dopamine is an excitatory brain chemical. It's a stimulant, so we want to be very cautious, but it can help with focus and concentration. And again, as I mentioned before, I've seen it work in females with language, or better in females for language than males. But I've had kids, and this is one of my favorite stories, and I've told it a bunch of times. I was at a TACA conference in Georgia before COVID, and a mom came up to me and talked about her child, and I said, yep, she needs dopamine. And so, gave her the supplement that we have that increases dopamine. She came back 2 days later and said her child went from nonverbal to having a few words in a couple days. Okay. And I've got her story in my book that I'm writing, on autism. And so we've got a lot of family stories there, and that story's in there. So I'm excited about it. All right. So let's switch over to a couple research studies. Here's a research study on dopamine dysfunction in autism. We know that dopamine is required for reward processing and behavioral learning. Okay, we know that's why ADHD meds are all about dopamine. Dopamine in autism and dopamine agonists and their possible use in treatment. Since there's altered dopamine signaling in our brain circuits with autism, increasing that dopamine activity in the brain helps. Okay, they didn't really line that up in the abstract very well, but I just wanted to kind of walk you through it. So with our kids with low focus, low attention, you may have tried ADD stimulants like Ritalin, Concerta, Adderall, methylphenidate, what have you, right? So sometimes they work. Sometimes you get a lot of hyperactivity side effects. So I want to make sure you guys are trying all of these to see what can help your child get the language that they need, all right? But be careful when you start giving supplements that change brain chemistry. You are going to have a risk of hyperactivity, all right? You start boosting that adrenaline, you start boosting dopamine, you start boosting glutamate, you may have hyperactivity and sleep issues, okay? Excuse me, sorry guys, I had the flu this weekend. It was not pretty. So we want to make sure you're balancing these neurotransmitters in the right order. So, again, I'm repeating myself, but a lot of times I'll talk to families and they'll say, hey, I heard about folinic acid, or I tried B12 shots, or I tried leucovorin, which is just pharmaceutical folinic acid, same thing. And they'll say, yeah, and you know what, I got some words, but then my kid just was bouncing off the walls, so we stopped. And I don't blame you, like, hey, a couple words is great, but you've got a child who's not sleeping and just going crazy in the house, and hey, maybe there's something different I can do. So I heard that story so much that I wanted to prevent that. Excuse me, guys. I wanted to prevent that. That's where I created this 4-step process. Let's reduce the glutamate and the adrenaline with the anger management. Let's push on the brakes. Let's increase that serotonin with our super serotonin supplement. Now we can start with folinic acid. Now we can start with some dopamine push. That's our attention on the double supplement. So I want you to follow this pattern, okay, or follow this protocol and see what works for your kids. Now, for those of you who have tried it, adjusting things for your child is the best thing to do. It's the best way to go about it, okay? Because hey, we're all a little different. Our brain chemistry is all a little different. Genetics are all a little different. So, start each supplement one at a time. And if you like the effect, but you want more, add a little more, okay? If it seems like it's too much, like the dopamine supplement, back down on the dose. You can adjust these based on how your child responds. But if you do this for a couple months, you're going to start to get language out. Again, it works for a lot of our kids. Nothing works for everybody. If it doesn't eventually work after, a couple months, then we've got to go down other roads and check other things. But it's an amazing thing to try. All right, let's do this. I want to get to the live questions. Before we do, let's show the coupon of the weekend. Coupon of the weekend is going to be Speech 20. That's right. Speech 20 is going to get you 20% off any of our vitamins, any of our supplements, any of our lab tests. That expires March 2nd, 2025. If you want one-on-one help with me, telemedicine appointment, you can schedule it on our Spectrum Awakening website. I think we're booking in April right now. Of course, it's almost the last day of February, which is pretty crazy. Excuse me, guys. All right, let's get to the live questions. Before we do, as I mentioned before, I'll mention again, we are launching our new high-dose folinic acid supplement. It's coming out very soon. I'm waiting to hear from my producer. If you want to be contacted, as soon as it's available, type the word FIRST into the comments section or DM us the word FIRST. We've got this automated program. It's going to put you on a list, so we'll email you as soon as it's ready. You'll be the first to know. So type FIRST to be the first to know. All right. I just saw Sophia's question. I like that, but I got to go in order. Hold on. All right. Live questions. We've got, here we go. Angie. Hey, doc. Sarah's doing better. Since we started yeast and anti-inflammatory treatment, aggressions reduced 70%. Angie, that is awesome. So first off, thank you for sharing stories. This is what I love, and this is what I need you guys to do, okay? We need to inspire parents everywhere that they can help their children, and they're going to believe you because you have a child, you've seen changes, you've done something, they want to know this, okay? So it's stories like Angie where their daughter Sarah was having a lot of behavior issues, okay? And as we talked about in our behavior podcast a couple weeks ago, behaviors are often caused by gut infections. So we did a yeast treatment and an anti-inflammatory treatment, and aggressions for Angie, or for Angie's daughter Sarah, reduced 70%. That is huge, Angie. That's awesome. I just talked to a patient this morning who her son, a lot of self-injurious behaviors, okay? To himself, to teachers, to parents. And I put him on our colloidal silver bullet, kill off the infections in there, all right? Turned out he had C. diff. We did poop testing. He had C. diff. As soon as we started the colloidal silver that was killing the C. diff, his self-injurious behaviors reduced 95%, the mom said. I mean, it's amazing. We have so many of our kids are just, I want to use the word suffering, but they're not feeling good. They're not feeling right. Okay. They're not going to hurt themselves if they're happy. So, they're going through pain, and so many docs don't know what to do to help. So they put them on psych meds. They're like, oh, you're unhappy? Here you go. Here's some Prozac. Now you're happy, right? But they're in pain. They're in pain because they have an infection. So I love that we can help behaviors by killing off gut infections. Thank you, Angie. All right. Selma, hey, doc. Weston just, so this is a patient. Weston just said mommy for the first time ever 2 weeks ago. He's 5 years old. And when I tell you I cried like a baby, my message to parents, don't give up. It can be exhausting and stressful trying to pinpoint issues in our kids. And sometimes there's setbacks, but don't get discouraged. There's hope one day at a time. I'm so thankful for you. Selma, thank you. That's a story that got everybody. But I love that stuff is working for you. That's what it's all about. So let's keep it up, Selma. We'll get there. Oh. All right. Chloe, can a 2-year-old take your folinic acid? Yes, yes, and yes. Luce. Hey, Luce. Luce, were you at Taka? All right. My son does a lot of side glancing and gazing. Oh, one of these, huh? Yep. Okay. So side gazing has to do with double vision. All right. So where should I begin? Let me back up. All right. Our eyes, okay, move with muscles. Hey, look at that. Okay. And they move together, which is pretty cool. Because if they didn't move together, I'd have double vision. My wife can do that. My wife can keep one eye still and make the other one go crazy, right? Excuse me. Sorry, guys. So those muscles need to work together in order to make our eyes work together. And there's 6 muscles on each eye. That's 12 muscles that need to work in coordination for our eyes to follow together. This is called tracking, all right? Because we're tracking an object. Now, sometimes if our eyes aren't tracking well together, we can see far away just fine, but up close, it's double, right? It's double right there. So what you can do if it's double vision is like, I can isolate just one eye. And now I can see something in focus here because I can't hear. That's what's going on in our kids with side glancing. So you can do 2 things. Number 1, I believe it's a mitochondrial issue. Okay, we're looking at motor tone issues of the muscles of the eyes. I would start giving mitochondrial supplements like our Mitomax. But I would also take your child to a behavioral optometrist. And a behavioral optometrist is a specialty in the eye doctor field, and they work on tracking. They work on eye tracking, and they have exercises for eye tracking. We've got, here in Connecticut where I am, we've got 3 behavioral optometrists that I refer to, and it's, I'll tell you, when that's the issue, the treatment is permanently amazing. And it's great. So look, there's a website, COVD, Charlie Ostrich Victor David.org, and you can just, put in your zip code and you find people nearby. Find somebody that specializes in pediatrics. Excuse me. Oh, the flu or RSV, I tell you, it was not fun, guys. Armando. Hey, good to see you, Armando. Hey, my son's been on anger management for 3 years. He's grown a lot. How do I know if I have to increase the dose? You never know till you try. So you know what, Armando, give Enzo a double dose for a week and see how he does. And if he's better, keep it up. If he's the same, well, go back to that lower dose. Lori, do you think this info also applies to children who have motor planning speech issues like apraxia? Yes. Yeah, I do. Apraxia, dyspraxia, yeah. Again, we may have to add in some mitochondrial treatment if we're really looking at muscular issues. The tongue, what's more of a muscle than the tongue? It's the only muscle you can see without cutting the skin. All right. Let's see. A lot of people sharing. Thank you. Ianthe, come to South Africa. Ianthe, I'd love to go to South Africa. I love to travel. And you know what? The only place outside the U.S. I've been, or outside North America is Europe. So I haven't gotten to Africa or South America or Asia or Australia. So I would love to. I sense a family vacation. Jasmine. Hey, Jasmine. Hope Charlie's doing well. What supplement for OCD? I think it's PANS related. Would you recommend increasing anything? Well, I'll tell you what, Jasmine. Patient I talked to today. This was the patient with the C. diff and the colloidal silver and the aggressive behaviors. And the child also had OCD that matched the behaviors. What was interesting is when we upped the colloidal silver, the OCD went away and the self-injurious behaviors went away because we were killing an infection causing those. But the mom then added probiotics, and the probiotics started to increase the OCD. So I think it might have to do with this gut inflammation issue. So I'm not exactly sure what we're doing with Charlie at the moment, but if you want to drop probiotics, if you're giving any, for a few days, see if that helps. If you want to up our antimicrobials, we could do that. Make sure he's pooping, obviously. Let's try those things. Excuse me, guys. Congestion. You know when it's just like stuck in your sinuses? Lisa, I have the same question about as Jasmine. PANS has been rolled out. Yeah, Lisa, gut infections. I'm telling you, they are such a big issue with our kids' behaviors. Such a big issue. So try our colloidal silver, maybe our yeast mold bundle. Luce, my son's already on our multi-spectrum complete multivitamin, Power and Focus, and Superfluidic. Should I start anger management combined with these? If behaviors are an issue, yeah, I would. Sorry, guys. There's going to be people listening to this podcast not seeing that I'm getting over a cold and be like, why is that guy so confident sniffling? All right, we've got, let's see, Skylar. Can you take methylfolate or does it have to be folate acid? No, you can take methylfolate. You can take methylfolate and see what it does, and then try folinic acid and see what it does and compare. And I really would do that because maybe your child respond to one better than the other. Who knows which one, you know? That's the thing with research. You know, you look at scientific research, and, you know, you get studies that say things like, hey, 70% of kids improved with whatever, all right? That's awesome. But what about the other 30% of the kids? Did they just not respond? Would they respond differently to something else? Would those 70% of kids respond different to something else? Who knows? All right, Bella from Carlsbad. Can I give my 50-year-old daughter super serotonin in the morning? Yes, unless it makes her tired. My daughter speaks like a YouTuber. I'm not sure what that means. Can this change for the better, or is it a good start? She has a lot of language and speaking as YouTuber, but when trying to conversation with her, she's limits in her words. Sleeping's bad again. Parasites? What got me, Bella, is you said sleeping is bad again. So there's got to be a trigger. Why are we sleeping bad again? And what happened to change that? What else happened during that change? I would look at gut infections first, but are we also dealing with hormonal stuff? What's the timing of the hormonal stuff and the sleep issues? There might be a lot to that. All right, Rita. What are your thoughts about using theanine for anxiety and hyperactivity? No, what do I think? I think theanine is very gentle. I do not think it's a strong treatment. I have theanine in multiple of my supplements. I like theanine, okay? Theanine can reduce the glutamate action in the brain, but I don't see it be very strong. And look, I've used theanine and compared it to other amino acids like 5-HTP and GABA and such, and it's gentle. It's a little, it's like, you know, a nice pat on the back. You're like, well, let's be calm, okay? So I don't think it's bad, but I don't think it's huge. That being said, I have it in my supplements. Claudette, my 12-year-old has severe anxiety. What would you recommend? Well, first thing I would suggest, as for most of our kids, is our super serotonin supplement. More serotonin, more happy, all right? However, are we dealing with preteen hormones? And did the anxiety start recently? If that's the issue, then I would look into our temper tamer supplement. That can help a lot. My 12-year-old daughter has a lot of anxiety now. She's like, you're like, what? Just what? What about what? So look, I wouldn't want to be a preteen again. I don't want to go back to junior high or middle school. No, thank you. It's one of the most anxiety-driven parts of our life. Try the temper tamer if it has to do with this timing. All right, guys. Tiffany says, are these supplements pills? No. So we formulate 75 to 80 different supplements for our kids. I try to make things as powders because I know most of the kids can't swallow pills. Excuse me. So the anger management, the folinic acid, the attention on the double, those are powders. The super serotonin's a chewable tablet. It's soft like a pencil eraser. So you can crush it or you can chew it. Some of our supplements are pills, but nothing that we talked about. Sophia, this is the question I got excited about. So Sophia asked, what's a high titer number for MMR vaccines? What she's asking, well, the quick answer is over 300. What she's asking, the long answer is, you can run blood tests to analyze if someone has had an effective response to a vaccine. Okay, so let's take the MMR shot, all right? The MMR shot, its goal is to make us immune to measles and mumps and rubella. That's what we want, right? Without side effects. So you can run a blood test and see, did my immune system respond to the MMR shot, and am I immune? Great. That's what we want. We want to be immune. We want enough immune response to the vaccine that we won't get sick. What's happening in some of our kids with autism, this subtype of autoimmune autism, starts to have an over-response to the shot, over-response to the vaccine. And that over-response can start to spill over into attacking the brain. So the immune system's responding to the measles portion, the mumps portion. I don't see it, the rubella. The measles or the mumps portion, and then spilling over and attacking the brain. So I will see the level be over 300, all right? It says over 300 on the lab test because the machine doesn't count any higher than that. The immune response is so big, it's more than the machine has been designed to calculate. That's pretty big, right? So short answer is over 300. Long answer is the why. But I'll tell you this. I've seen adults, 40s, mid-40s adults with psych issues have over response to the MMR shot where other people know. All right. It's not just our kids with autism, but it definitely has to do with brain development. All right. Ruby, my son's always pushing under his earlobes. I've had his ears checked and all is good. I have a dental appointment. Just wondering if it could be anything else. Yeah, go with the dental appointment, Ruby. Yeah, go with the dental appointment. Under his earlobes like that? Yeah, tooth. Yeah, go with the dentist. All right, Lisa, we've been taking Power and Focus. No results. Should we increase the dose? How long does it take before we see results? Lisa, I would say this. Spectrum Awakening has a 30-day return policy on its supplements. And it has that because you should see a result within a month, okay? If you see a result within a month, keep doing it. If you don't see anything, I would stop that and try something else. So do this. If the Power and Focus after a month hasn't done it, I don't think you need to increase the dose. I would switch over to the Skowron solution, which is the 4 supplements we talked about today. Try that, or we'll keep going. Samantha, are you uploading this to your podcast channel? Of course we are, Samantha. Yeah, give us a week to do that. Tam, hey doc, I need to book an appointment. My daughter is taking the MTHFR, folinic acid, and super serotonin. We're trying to pull speech and help with focus. Oh, Tam, anytime. Just go on our website, Spectrum Awakening. You can book it online. All right. Nikki, hello from the UK. Would you recommend folinic acid? Yes. For my 6-year-old nonverbal son, definitely. You're in the UK, Nikki. Our European distributor is called Mandimart. Mandimart. Okay. They're our sole distributor in Europe. So you go to mandimart.co.uk. You go to mandimart.eu, depending on where you are in Europe. And you can get our supplements there. I just text Joe, who's the owner of Mandimart, or the manager. And we're gonna make sure he gets that high dose folinic as soon as our producer has it. Child has good speech, was reaching developmental milestones, and had a regression, lost speech and behaviors. He's not aggressive, which is great. But yeah, Nikki, get on our folinic. Okay, go to Mandimart and grab it. Tam, do you need to do anger management if she doesn't have behaviors? I would still try it because the goal of it is to prevent the side effects of the folinic and the dopamine. So, yes. Lisa, what do you take to increase dopamine? It's our, do we have it here? Where is it? I don't think I have it here. It's our Attention on the Double supplement. Attention on the Double is going to increase dopamine. Omo, how do you stop masturbation in teenage kids? Omo, this is a great question. And, unfortunately, it's one that's avoided a lot in our society, but it needs to be talked about. So I would say, let me give you a short answer. Short answer number 1, I did a full podcast on this last year. You can go back, find that podcast and listen to the whole thing. Number 2, you can't. Yeah, I was jokingly talking to a patient at a conference years ago, one in Pennsylvania. And mom came up to me and she said, my son's 14 and every night he goes into his room and touches himself and moans and moans and moans. Is this normal? And I said, every night? She said, yes. I said, really? She said, yes. I said, no, that's not normal. She said, it's not? I said, no, he should be doing it 4 times a day. And that, is jokingly just kind of accentuates teenage behavior. So I don't think it's medically healthy to stop, but I think it's appropriate to contain it to a certain area. So I think it's something you work with ABA, something you work with OT, just like toilet training, okay? Here's an activity my body does, and I do it in this room, okay? Here's another activity my body does, and I do it in that room. I mean, trust me, I remember, this is before COVID, I would have patients in my office humping the bed while we're having our appointment. And the mom would look at me and go, "What's he doing?" And I'm like, "Oh, Mom, we got to have a little talk about what he's doing. You can talk to his dad too about it." I think it's just about making it happen in the right place, because it's socially awkward not in the right place. But listen to that other podcast. Maria, yeah, let me get a hold of my front desk about that. Kathy, what do you recommend for seasonal allergies? I've tried this for a couple years, even though we aren't in bloom. He has issues. Kathy, I want you to try our supplement Allergon. Allergon is a great way to help remove histamine from the body and reduce those kind of symptoms, because you just can't avoid everything. Carolyn, what are your experiences with choline and butyric acid? I like choline. It's in our folinic acid supplement, right? It's in our Power and Focus. It's in our multivitamin. I love choline. Butyric acid is good for the gut, but tastes absolutely horrible. You can have your body create its own butyric acid by giving fiber, okay? Or a prebiotic. Skylar, can it be methylfolate? No, we answered that one. Rodney, thank you. Rodney says always an informative show. Rodney's always on. Yeah, Carolyn, you can add that city choline. That's fine. Carla, your thoughts on S. boulardii for yeast and golden seal? I like them both. You know, we've got a Sac boulardii supplement. You know, Sac boulardii is everywhere. Golden seal's great. What should I add from your line to get rid of candida? Make sure you get a binder. When you're killing these bugs off, you want to escort them out. Get a binder. His eczema's at his worst. If he's got bad eczema, excuse me. Sorry, guys. If he's got bad eczema, I want you to get his allergies tested. Get his food and environmental allergies tested. You know, actual allergies, not sensitivities. Go down that road for true eczema, okay? And what do I mean true eczema? Eczema on the wrists, in the elbows, on the face, behind the knees. This classic eczema versus non-classic eczema. I feel like everybody calls everything eczema, like red skin eczema. Jasmine says, hope you're feeling better. Thanks, Jasmine. Yes, I am actually 90% better than I was 2 days ago. This cold was nasty. Next, Ellie. Have you tried thyme essential oil in a diffuser? Thank you, Next, Ellie. I have been, there's thieves all over my house for sure. All right, so looking for more live questions. Here we got a few. Diane, my son has a hard time to convert dopamine to norepinephrine. Is this permanent? I'm giving B6, MAG, SAMe. Sometimes it is, Diane. And really the only way to treat it, if that's the case, is with certain ADHD stimulants that are norepinephrine agonists. But you may also want to add some vitamin C and some iron to get this conversion going. But if you test your levels and the dopamine's always way higher than the norepinephrine, you just may need to go with the stimulants. Carla, detoxing heavy metals for how long? Months to years until they're gone. You do it until they're gone. You know, my wife, I'm cleaning the house. I asked my wife, how long should I be cleaning? She's like, until it's clean. My wife likes to do that. What do you use? Well, make sure you try our newest supplement, Detox Dynamite. I know it's backwards. This is we just got this out last month? Sorry, guys. But it's great. It's got modified citrus pectin, the fulvic acid, humic acid, the zeolite, charcoal, silica. It also has a lot of molybdenum. And somebody asked me, why all that molybdenum? It really helps with sulfur processing, which is needed. Halo, which supplement helps with speech? Everything we talked about today. That's the point. Susan, my son's going to go through puberty. He's having anger issues. Any suggestions? Good Lord, yes. Where did I put it? Try this one, Susan. All right? This is my go-to for puberty behaviors. Temper tamer, hands down. All right. Ellen, why can folinic acid cause exhaustion and irritability? Well, exhaustion, I'm not sure, because it's normally very stimulating. The irritability, is that due to being tired and can't fall asleep? Or is it due to changes in adrenaline in the brain? Not sure exactly why, but again, this is why I've created this 4-part protocol to kind of prevent these type of side effects. So that's why we have the anger management, why we have the serotonin supplement, then the folinic, okay? Because these side effects are common. Tina, would you be able to make folinic acid alone in powder form? Well, we do have, this is our superfolinic acid. It's a powder, okay? It's got a couple other cofactors in there that help it absorb, but, small doses, just enough. Things like adenosyl B12 and a little vitamin D and a little choline and a little ATP, all right? But yeah, that's just a folinic acid powder. Daniela, what's the dose of folinic acid for a 4-year-old? We're going to be talking about this next week in detail, but I would start with 1 milligram. So for our powder, that's 1/8 of a teaspoon, really tiny amount. Ariana, when will the Skowron solution be back in stock? Let me look into that. I hope very soon. Jeannie says, thanks for being open to address masturbation. Sometimes it's a shameful thing for our kids. Jeannie, you're welcome. I think, there's no reason we shouldn't be talking about life. And why? I mean, I know the answer. Look, I live in New England, and we definitely have this puritanical influence from the 1700s about sex and about masturbation. And so it's something that is deemed shameful and that we don't talk about, even though it's life. It's part of life. So, and it's something we do with our kids. So yeah, we need to talk about it, maybe it's just whole part of the doctor thing where we go into, conversations and appointments, and we talk about sex and we talk about genitalia, and we talk about these things because they're real. And can we just talk about it plainly without any emotion behind it, without the shame, without the expectations or the embarrassment or any of it? So yeah, I get it. Kathy, have you seen increases in impulsivity behavior when using calming cream? No, but some kids do react to B6, so it's possible. Capri, what can I do about my son stimming? He never seemed to do it, but now he's spinning around in circles. Oh, Capri, that sounds like a yeast infection. Try our yeast mold bundle. All right. Celine, what can I do for my child chewing on clothes? I want you to try our serotonin supplement. Again, as we saw in that research today, it helps with the sensory. So try the serotonin. Sherry, protocol for kids with fetal alcohol syndrome. I don't have a protocol for that, Sherry. But good question. Tiffany, what's the best thing to mix the powders with? Whatever your child likes. It doesn't matter. Just get it in there. Carolyn, get some rest and get well soon, Doc. Thank you, I will. My boys are doing much better with anger management, folinic acid, probiotics, B1, and omega. Now I want to optimize their improvements with some citicoline and some alpha GCP and some butyric acid. Awesome, Carolyn. Tell us how it works. We always want to know. We always want all of our kids to get better. Lewis, is there a best time to give folinic acid? The morning. Just because I don't want it to affect his sleep. Samantha, suggestions for chronic toe walking. Constipation. Get that child pooping completely. Not little piles, complete poop. All right? Try our brown log train if you haven't done it yet. Candid, does your protocol help with institutional autism? I don't know what institutional autism is. What is that? How's that different from another autism? Hey Lou, which supplement helps speech for 4-year-olds? Everything we've been talking about today. The anger management, the super serotonin, the super folinic, and the attention on the double. We do it in this order because we want to make sure we're balancing all brain chemicals. That is going to improve that language. Okay? So this is why we're talking about all 4 of these. Naxeli, yes, Naxeli, I'm going to get in touch with you about our Spanish program. Definitely. 100%. I am doing this with you. Okay, I'll get on it. All right, guys. Excuse me. All right, I'm good. All right. Hey, language. Big issue for our kids with autism. Okay, so many of you want more language from your kids, all right? One of the most scientifically researched vitamins to get more language is folinic acid. It's a form of folic acid. And I want to make sure everybody tries it. We're going to have a podcast next week about folinic acid in detail and talk all about it and dosing, etc., right? But it causes a lot of hyperactivity and side effects with a lot of kids. And that's because, you want to make sure we're balancing all the brain chemicals. And with our kids that have a lot of overactivity, we need to do more than just give folinic acid. We need to pull down glutamate and adrenaline with our anger management. We need to boost that serotonin for language and for sensory and for auditory understanding, right? Then we add the folinic. Then we start boosting that dopamine a little bit, all right? So it's a protocol with an order to prevent side effects. And so, look, I know plenty of people, plenty of families like, hey, my doc gave me folinic acid, my doc gave me leucovorin, and you know what? It works. I got the language, I got the words, but I also have a kid who's not sleeping. So what do? So this is why I created this protocol for my patients and for you guys to try. So I hope that made sense. I hope that helped. And yeah, that's where we're going to try it. So if you haven't tried these things with your kids, please do. And again, next week we'll go in detail about folinic acid and dosing, etc. So if you're interested, coupon for the weekend is Speech20. Use that coupon for any of our supplements, any of our lab tests on our website. That expires March 2nd. And if you're interested in our new high-dose folinic acid supplement that is going to be launching very soon, then type in the word first into the comments or DM us the word first, and you'll get automatically placed on this email list. Douglas, I'm going to add, Rose, is this on the website? Yes, it is. Carolyn says anger management is pure gold. Yes, it is. Douglas, I want to try this, but I'm very skeptical with it involving her health. How can I guarantee it's safe for her? Douglas, great question. Let me answer that with two things, and then we'll wrap up. Number one, any of the supplements that we manufacture have been categorized as GRAS safe by the FDA. Okay, so these have already have clearance that these are generally recognized as safe. That's the FDA's approval rating of these nutrients. So from that perspective, medically safe when used in the right dose. Okay, just like you wouldn't want to take an entire bottle of multivitamins. Something might happen. But the other thing I want to mention, Douglas, is for effectivity, Spectrum Awakening has a 30-day return policy. So you try it and it works, awesome. You keep using it, right? You try it, it doesn't work. You want to send it back for a refund, go ahead. Because there's too much out there to try, all right? But these are the supplements that I manufacture for my patients in my practice. Yes, I want them safe. Yes, I want them to work. So that's why we're here. All right, everybody. Thank you for tuning in. Thanks for doing everything you can to help your child. And we will see you next week. Have a great weekend, everybody.